we're all here for the same purpose, which is to win some important policies which can help us end this pandemic in a way that's just and reflects basic human rights, and begin the long process of fighting for structures that can actually prevent future pandemics that are certainly coming down the pike. And the first way we're going to do that is by having a whole pile of meetings with members of Congress. And so the purpose of this training obviously is to help you engage in a whole bunch of meetings over the next week or two and do them effectively. So just some context and some background. Again, this is not unfamiliar to any of us, but we see the COVID-19 catastrophe as being driven by basic violations of human rights, but also presenting a really profound opportunity and deep demand that all of us organize with one another and with the communities who have been most affected to fight for justice. We know that COVID-19 has, and the disaster it's wrought, has been built on really accumulated devastation that's been especially concentrated on historically built devastation in Black and Brown communities especially. That it's been driven by combined forces of corporate globalization, its twin climate change, and the deforestation that is driving changing disease ecologies that lead to zoonotic infectious diseases to emerge. So we know that this isn't going to be the last of these pandemics, and that we need to be fighting for policies that can prevent these things from emerging, or at least having the kinds of devastations that we've seen from COVID. And last but not least, we know that this is going to be a moment where new technologies, whether they be vaccines or tests or antiviral pharmaceutical therapeutics, they're going to be developed and they will be effective. But we also know that if we don't fight against big pharmaceutical companies, those companies will charge unruly prices, and they will be extremely inaccessible to the people who need them most. So this is, kind of, again, super high level, but some of the things that we see are profoundly at stake in this moment and why we must be working together to fight back. And so, yeah, we see this as a moment to act together. There's a real potent moment of urgency in these next 2 weeks while the HEROES Act is being debated. We'll see. There is a chance that the House will vote tomorrow on the HEROES Act, but Pelosi is also seeing significant pushback from the Congressional Progressive Caucus. So, and they want other important demands included in this act. We just heard from colleagues in Seattle who are working with Representative Jayapal, who is specifically working to organize folks in the Congressional Progressive Caucus to push the leadership in the House for a set of demands. And they're actually including our demands in those asks. So what we're fighting for specifically right now are three key things. The first thing is a large, well-funded community care corps, which would essentially be a large-scale jobs program to hire people who are currently unemployed because of COVID, people who are specifically in communities who have been most affected by COVID, to stand up contact tracing teams to actually support people diagnosed with COVID to be able to safely and effectively isolate in their homes or wherever is most safe for them. So this would be a large-scale contact tracing program nationally that would be implemented in all 50 states. Currently, there's $75 billion in the HEROES Act, but there's very little specification about how much those contact tracers should be paid. We think they should be paid a living wage, $25 an hour, or pegged to census taker wages. We also think, again, those jobs should be targeted specifically in communities most affected and communities of color. The second big demand that we have is that we guarantee that all medicines developed with public funding be kept in the public domain and enabled to be priced effectively and fairly. And we think that that's really, really important as well. I just want to make sure there's nobody being stuck. Oh, there's a couple folks. Sorry. I have to manage the folks who are stuck in the waiting room, and I want to make sure that everyone gets in. So the third big ask that we have as a part of our pandemic prevention plan is that, we can't stop a pandemic just by focusing on the United States. There has to be a global response. And so we're calling on Congress to appropriate $12 billion new dollars for a global pandemic prevention, which would support ministries of health to build contact tracing programs, much like we're calling for being built in the United States. We know that we can't end the pandemic or open our economy until we have contact tracing in the United States. The same thing goes for Rwanda or Sierra Leone. And so we ought to be helping support those governments and taking that on. We also have to be making sure that ongoing commitments for funding for HIV, tuberculosis, malaria, and broader health system strengthening efforts are contained as well. So these are our sets of asks, which we think are crucial to ending the pandemic. And we think actually have some momentum, especially amongst progressives in Congress right now. So if we win, if we rise up together, if we seize this moment and work together to have hundreds, hopefully, over time, meetings with members of Congress and continue to escalate our pressure, this would certainly save lives and livelihoods. It's not that we're anti-economy, but we know that the only way we can restart kind of getting back to our daily lives is if we fight for a just response. We know that we can't decouple the local and the global response, that what we do here can't be separate from how we engage with and support formerly colonized nations in repairing the damage done. We know that this is necessarily an opportunity to rebuild long gutted public health infrastructure. And perhaps most importantly, we need to be working together to build power, real grassroots power within the broad health and human rights movement. And we need to have it be focused on, again, reparations, really repairing the damage done by generations of racist and short-sighted economic and social policies. So what now? I mean, again, we're diving in. The rest of the next, 45 minutes will be spent thinking through exactly how we launch these meetings with members of Congress. There are lots of ways we can engage with our members of Congress. So all of you hopefully have sent letters to your representative and senators. We have a really easy tool through Action Network to allow you to do that. Maybe Amu, you could drop that into the chat. If you haven't yet sent your letters, please do that on Action Network. It's a really easy thing to do. The other way we engage with members of Congress is through the phones. We're actually not going to prioritize that right now. What we want to focus all of our efforts on right now is in having as many face-to-face via Zoom meetings we can with some members of Congress. We have a meeting set up with Congressman Andy Levin, but most of these meetings will be with congressional aides or staffers. So I want to pass it over now to Pranav, he's a longtime results organizer and has been trained in this stuff. I want for him to lay out and explain kind of how we think about engaging with members of Congress and how we structure meetings.
Yeah, thank you, John. That was a great introduction. When we go in there to talk to our members of Congress or their assistants, learning to speak powerfully about the issues is one of the most important tools which we would possess. The best way to do it is through the EPIC framework, as John says, a framework for victory. So this EPIC format includes 4 compartments. That is engage. So this is like an attention grabber. If you've taken any basic English writing class, you know that there's always this one chatter at the beginning where you say, "Did you know?" and you state a quote, and that's how you grab the attention of your readers, right? So here in Engage, when you speak, you're just going to do something like that, and you're just going to grab the attention of your listener and just dive into the topic you want to talk about. Second is problem. Here you state the problem clear and compelling way. So now you have their attention. You just say like, hey, so do you know what the problem is? More than 20% of Americans are out of work, and we're entering the worst economic collapse since the Great Depression. So just a simple problem mentioned over there after grabbing their attention. And then inform is where you share data, statistics, but most importantly, here is where you share that personal story of yours. The most important part of having a meeting with your member of Congress is actually sharing that personal data, like personal information, not personal data, sorry, personal information. So your personal story can basically be like, we need a plan to stop this outbreak, support a just recovery, and take the intentional and international action necessary to stop future pandemics from happening. A pandemic is not over anywhere until it's over everywhere. Me, as your constituent, have been facing these issues, so and so. So you just like share your personal story over there. Just clearly humanize that issue, which is more than just stats and data from an internet tab. Next slide, John. And call for action. So call for action is one of the most important aspect of this. This is where you actually get very specific towards asking, now that you heard, now that I have your attention, I stated the problem. I also informed you on why this is so important to me, why this is important to millions of Americans and on a global scale. Let me tell you what you can do. I have a solution, and can you say yes or no on this specific ask? You can say, will my member of Congress commit to drafting an amendment and circulating a congressional sign-on letter, a Dear Colleague letter that includes COVID-19 legislation and follow the three important policies which John mentioned earlier, which we'll talk more as well.
Great. So that's, kind of the high level kind of format that a meeting with a member of Congress usually goes by. But I want to share with you, there's a link in the agenda to a draft template agenda, which can allow you to very easily structure and craft your specific meeting. So, this is not rocket science. It's a humane conversation with people who also care about these issues. And so we want to make it as easy for you to do this as possible. I just want to kind of walk through this document with you real quickly. It hopefully is helpful. The first step is obviously just to set up the meeting. There probably will be some kind of time in which people are gathering together on Zoom, just like we were earlier. It's an opportunity for you to engage the staffer in small talk. Show your in-district cred by talking about local fun establishments or places that you used to go to, or where folks are. And then once everyone is there, it's an opportunity for you to obviously thank them for the meeting, and really importantly for you to thank them for something that their boss has recently done. Even if it's something small, especially if they're a Republican, it's a way of building some rapport and showing that you actually know what the member is doing in Congress. It's important for you to confirm the length of the meeting. These will usually be 30 minutes, but if they're shorter for whatever reason, you might have to adjust your agenda accordingly. So then the meeting will begin. And this is your opportunity to do a very quick round of introductions: name, location, and a one sentence statement about how COVID has impacted you briefly. And there's a couple of examples here, again, for you just to use and see as examples. Then it's an opportunity for you to have the person who's leading this portion of the meeting to state the problem in as clear terms as possible. And again, we have some talking points here that are useful. We don't need to go into all of these. And importantly, in your meetings, you don't need to go through all of this entirely. You can pick and choose the sets of talking points that are most useful for you or most resonate closely with you, or what you think might resonate most with the member and their staff. And then it's an opportunity for everyone in your group, or at least a couple of people in your group, to share your stories. Again, these need to be really brief, and we're going to get a chance to practice this in a second. But we really want everyone to be able to share a 1 to 2 minute story about why it is that you've taken this up. You know, each of us are here for particular reasons. You know, you're here on a Zoom call late in the evening, and you're going to be, you know, doing more work even on this in the future. So why is it that you're called to work on this? And we each have our own personal story for why we choose to do this work, and it's really important for you to share that with the staffer. And then lastly, you know, it's important to have one person who's in charge of making a very specific, crystal clear ask for a commitment for the member to do something. And the standard commitment that we're going to be asking for is that they commit to supporting amendments to the HEROES Act that lay out the sets of demands that I laid out earlier in the talk. And again, there's specific language here that you can use in making that specific ask. You know, that will be the end of the meeting, and you'll have a chance to really crucially, importantly, thank them and lay out next steps and follow up. So that's, you know, again, this is a tool. You'll have a chance to obviously read this. This is all in the agenda, and we'll follow up with you over email with these materials. But we want to, again, make this really, really easy for everybody to do. Now I want to pass it back to Pranav, who's going to carry us forward.
Yeah, thank you, John. So here is a sample format of how you can plan your meeting ahead. As John mentioned, not everybody have to do the introductions. They don't have to state that specific problem and do the call for action, but everybody has a chance to share your personal story. Just have that personal touch to your meeting. So here is just an example of if John, Amu, me, and Katie were in a meeting. John does the introduction. He introduces everybody in the group. Amu presents the issue. Everybody gets a chance to share their personal story. Katie says, thank you so much for listening to us, and we will be following up with you via email. And then I take those meeting notes, and then that will help Katie follow up with them as well. So just dividing and conquering your meeting would make it super effective. Next slide, John. So all the examples for EPIC are mentioned in these slides. These slides are also part of the agenda, so you can read about them later. So let's move to sharing my story. So to just make us all comfortable in sharing a personal story and practicing it, so I just wanted to give a small background into what brought me into advocacy and why I think it actually matters. So I'm a first generation American and a college kid who knew nothing about the Congress. While in college, I took medical anthropology and learned about global health for the first time. I read about how structures of systems have oppressed and not supported countries like Haiti, how we eradicated polio, the ongoing fight against poverty by trying to keep children in school, moms nourished, and saving people from dying because of preventable causes. It was eye-opening to me to know that Kenya, with a population of over 50 million people, have only single or double-digit amount of intensive care beds. This is when I realized that when it comes to building sustainable healthcare systems, the expertise of a doctor and an epidemiologist can be so useful, and hence healthcare, or perhaps access to healthcare, and politics cannot be separated. This was my call to action. I learned that the best way I can contribute is by using my voice, my privilege, and the position I have to speak about it. I realized that the advocacy with the right tools is the best way we can be a part of a democracy, be active citizens, and fulfill our civic duty. I moved from not knowing how Congress works, what their roles are, to understanding who reps and senators are, and receiving personal calls from them. To be completely honest, I'm still trying to figure things out, and that's completely okay as well. You don't have to know everything. And doing it for the first time was an interesting experience, and it was a great learning opportunity. I learned that they're just like us, people, but they will listen to anything and everything we have to say, because guess what? They actually work for us. So this is my personal story on why advocacy matters, and it matters the most right now because we're currently living in a pandemic, and the coronavirus catastrophe cannot be solved without the same solidarity and compassion, without the same global teamwork we did have for polio. Over 1 million people in the United States have already been infected, and there are reports of a possible second wave. So I decided that it is again important for me as a normal, everyday person of this country to speak up and raise my voice in supporting a sustainable pandemics prevention and protection plan, which can address skyrocketing unemployment rates, better preparedness for future pandemics at a global scale, and boost testing for COVID 19 and higher contact tracers. So I hope this story inspires every one of you to take action towards this as a team together in solidarity. So, John, can you move to the next slide, please? Thank you. As John and I mentioned multiple times, the personal story is the most important part of your epic talk and your meeting with your members of Congress. While I was advocating, I learned that our members of Congress are always surrounded by data, stats, and information from slides, internet, and all these other agencies. There's a favorite quote which says that you can't really hate a person when you listen to their story. This quote can be helpful when you're advocating with a Republican congressman or somebody who is not so keen to listening to your story. A personal story can have a huge impact while advocating. So here's one more example. For me, it was my lived experiences in India. I shared the importance of TB testing in India to a redneck from Kansas who actually ended up co-sponsoring the Global Fund, which fights for eradicating TB, malaria, and HIV as a pandemic. So he has never left the country before and has never co-sponsored a global fund or like any global aid before. My personal story had the power to move him and make that decision. So if I can do it, anybody else on this call has the potential to do it by just personalizing your story and just sharing your story. So if we all act together as a team, we have the power to influence our members of Congress because ultimately, as I mentioned, they end up working for us. Next slide, John. Some things to include in our personal story would be you can. This is just to let you guys know that this is where you can start thinking. This is not exactly what you have to include in a personal story. You can start by thinking how this pandemic has affected you, and if you're privileged enough so that this pandemic has not affected you, think about how it's affecting people in your community, your neighbors, the people you love, the people who are so dear to you, and why you personally believe that the People's Pandemic Prevention Plan would be so effective and beneficial, hiring so many people, making all these vaccines affordable. How are these things going to impact you as a person? And why do you think it's so important? You can bring in news, what you've been hearing in the news recently, and what your constituents are facing or your neighbors are facing, and just compel all together to create that powerful small elevator pitch on why you, my congressman, has to do this. Next slide, John. So next, let's divide into groups where everybody will be divided into pairs. Let's take 4 minutes each to share our personal story and a minute each to share feedback. When you're listening to your peers' story, just make sure you are an active listener. You're listening to understand and not just to respond. Just listen, understand, and make notes and share that and give constructive feedback to your peer so that you can start developing your personal story. Remember that you don't have to particularly perfect your personal story. This is our first meeting, and there might be anxiety, and you might have not done this before. That's completely okay. We're only doing this to provide a platform for you to start brainstorming, to just start thinking about in the right direction on how you can personally compile a story to help this. So yeah, John, can you please divide us into small groups?